First, do no harm. This is ingrained in us in medical school. It is part of the Hippocratic Oath that all students take as they are entering medical school. I am Cindy Rubin. I am a breastfeeding medicine physician and fourth trimester doc in the Chicagoland area. So first, do no harm. What this means is that above all else, physicians commit to not doing anything that will purposely be harmful to a patient. Great, right? Most of us, I think, go into medicine because we want to help people. Certainly, we do not want to harm them. But there are times that patients get harmed, and sometimes it is not preventable. Sometimes it is. Sometimes there are errors. There's lots of ways that harm can happen. What I want to talk about today is the Cures Act. So in 2016, Congress passed a legislation that requires medical systems, hospitals, other types of medical systems to release medical information like doctor notes, lab results, things like that. Those get released immediately as soon as they are finalized so that patients can access it and see it in their chart. Sounds like a reasonable thing. I mean, I definitely think that patients should have access to their charts, and other physicians should be able to access charts for good continuity of care. Sounds good in theory. But what happens is this happens automatically. In order to stop it from happening, you need to click some certain buttons. And sometimes the healthcare systems really make it hard to do. Like, okay, you're blocking this. Why are you blocking this? You understand that this goes against the Cures Act and all this stuff. So it makes you like, whoa, should I not be blocking this? Well, often, not sometimes, but often, what happens as a result of this is that patients get bad news via their patient portal, get abnormal test results that they don't understand, which can be just confusing and distressing, especially if you get those results on a Friday afternoon, and then you have to wait the whole weekend to hear from your physician. Or biopsy results, or an MRI, or a CAT scan result that says that you have a brain tumor, or some other sort of apparent tumor or malignancy, or whatever it may be. Yes, I get that the sooner you get this information, the better, but not if you're getting the information in a way that is not through your physician who can explain it to you in layman's terms and answer your questions and make your follow-up appointment, come up with that plan. If you get this news, whether it's on a Friday evening and you have to wait till Monday, or even if it's just at 5 o'clock on a Thursday and you have to wait till the next day, it can be very, very distressing while you're waiting. I mean, it's distressing to have to wait for the information too, and I get that. But this isn't appropriate, and this has harmed patients. And especially when things come back that actually are normal, but it's flagged as abnormal and it makes a patient really worry when they didn't necessarily need to worry. This was not thought through, and this is just another way that the system, that people who are not physicians have made all of these decisions that we have to follow as physicians that do harm patients, but we have no control. So first, do no harm, but if we want to get reimbursed by the insurance company or whatever, we have to do these things. And it's just not right. And I started thinking about this because this just happened to a friend of mine. And thankfully, the results were good news and not bad news on a Friday evening. But we need to go back to the doctor-patient relationship. That is what is important. The doctor-patient relationship, and that has been completely mucked up with all of the other things that are going on with insurance companies and government getting into an area where they don't take an oath to do no harm.